And health. I'm your host Munyengo, and if you're joining us right now, we're talking about the sixth leading cause of death in Kenya. And when we talk about this, we're talking about tuberculosis, and we are with an amazing nurse, Nurse Juma. Thank you very much for staying with us. You look very surprised.
Wow.
Thank you for that. Yeah. So, getting down on whatever we're discussing. Of course, we want to talk about the management of TB. What are some of how do you manage TB? And of course, when you talk about that, also we will talk about the treatment and management of tuberculosis. Yeah.
Okay. In management, management is wide, but
Yes.
we just break down to the few. And the main one, actually in management, you have the direct observation treatment,
Yes.
whereby the patient will be taking drugs under observation, especially for the first 2 months.
Yes.
Yeah. And also we'll also have to do the something called tracing of the defaulters, so that
Yes.
we can avoid the MTB increasing in the society.
Yeah.
We also have to monitor the therapy. How are we going to do this? We're going to do this through the sputum smear test.
Yeah.
Like we do it, we have the 6 regime, 8 regime, and 9 regime.
Yeah.
Whereby the 6 regime we'll do at the month of 2, 5, and 6.
Yeah.
And the 8 regime will do it in the month of 2, the 5th month, and the 8th month.
Yes.
And the 9th regime will do it at 2 months. 3 months, 5 months, and 8 months.
Yeah.
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 And also in management, we have the drugs part of it. So this patient will be put on drugs and being monitored.
Yeah.
Yeah, we have the REHAS,
Yeah.
that's the rifampicin,
Yeah.
isoniazid, pyrazinamide,
Yeah.
and the ethambutol,
Uh-huh.
whereby the last two drugs, that is pyrazinamide and ethambutol, they are taken for 2 months, and then the other one for the rest of the 6 months,
Yeah.
or the 8 months,
Yeah.
or the 9 months.
Yeah. So, going back to the treatment, what is the duration of treatment for tuberculosis? And another question: can it go beyond the stipulated duration?
Yeah, the duration for TB drugs is 6 months.
Yes.
But we can't just limit it at 6 months, because sometimes we find that some of the patients tend the bacteria tend to seems to clear in the
Yeah.
system.
Yeah, it
So
takes
you
some
have,
time.
Yeah, so you have to extend the treatment.
Yeah.
It can go up to 2 years.
2 years.
Yeah.
And about defaulters, there was some time that local chiefs and the CHWs were being used to trace defaulters. How effective is this, and why should you trace defaulters? Defaulters, for our viewers, are people who do not finish their medication. And why is it important for tracing of such people?
Okay, it's really important to trace the defaulters, because we know that if a patient can't finish the drugs, they tend to develop multi-drug resistant TB. You see, and that is the treatment of multi-drug resistant TB is hard. It's not like the normal MTB.
Yes.
Yeah. So it's the work of the healthcare workers, the community healthcare workers, to do the follow-up with the TB patients on drugs, so that they make sure that they have finished their doses to avoid multi-drug resistant TB.
Thank you very much. So when we talk about that, then something else comes in, the complications. So what are some of the complications that maybe one can find when the treatment, when they do not go fully with the treatment, or they do not finish rather the dosage that is advised or given to them?
Okay, some of the complications of TB is back pain, very severe back pain and stiffness.
Yes.
Okay, there are joint damages.
Yes.
That will mostly affect the knee and the hip joint.
Yes.
There are also meningitis, which is a very bad condition, and there are also kidney and liver problems, and also some heart disorders.
Yeah. So those are some of the things that when we do not finish these drugs, then these are some of the things that can come out of it, right?
Yeah.
And moving away from that, then of course we come to something else, the prevention. After all these things are done and said, so you as a health worker, you as a nurse, what are some of the things that you can do to maybe prevent or advise people out there to be safe from tuberculosis?
Okay, we'll start at the early age of
Yes.
this thing called the MCH.
Yes.
Yeah.
Mother-child health.
Healthcare, yeah.
Yes.
So there's BCG is
Yes.
given.
Yeah.
So we need to advise the society to take the kids for BCG.
Vaccination.
Yeah, vaccination.
Yes.
Also, we have to, I think it's good if we do organize for TB screening. So that we can diagnose early TB and treat it. We also have to teach people on awareness of the signs and symptoms so that they can go for treatment early, and also inform them about healthy coughing and everything. We also have to do you find like some of the kids, the children who are TB positive. It's also the work of the parents to make sure that these kids are taking treatment.
Yes.
Yeah. Also, we have to monitor the drug therapy. Yeah, to make sure that these clients are taking drugs.
Yes.
To ensure that there's no more spread of MTB out there in the society.
Yes.
And also, we need to give them support.
Yeah. Support is really important.
Financial support.
Yeah, emotional.
Emotional support.
Yes.
Yeah, it's very important.
Yeah.
Yeah.
And now, I think what about if we tie that with what the government should be doing? Like, what are some of the things that the government should put into action? You as a health worker, you have been you have been working for the health work for the people for a very long time. So what are some of the things that you will suggest the government to incorporate so that we can make sure that we have zero TB rates in the near future?
I think the government has to invest in training the healthcare workers, because first thing is to trace these people.
Yeah.
Also increase the accessibility of these drugs. We have to increase the points where the patients can go for the drugs. Also, the government has to ensure that they organize for outreach out there to inform the people in the society to know the signs and symptoms and when to see the doctor. And also, it's important for the government to ensure that they organize for screening for TB, free screening of TB, and all over. Yeah.
24th of March is going to be the World TB Day, and this year's theme is "It's Time." And "It's Time" is a very versatile theme, of course. That it's time that we end TB. It's time that we made sure that every person who has TB is treated and make sure that they've gone to the last step. What do you think also that what are some of the things that maybe should be focused on during this year's event?
Actually, I think I've named most of the points just before. Ensuring the healthcare workers are educated, and also the community health workers are well educated, and also increase their numbers to ensure that we are capturing all those people who are having TB out there. Yeah.
Any final words do you have for us, Nash, in regards to what the topic that we've been discussing today?
Okay.
Any words for our viewers back at home?
Yeah. Okay. What I can say to the society is they need to know that TB is curable if drugs are taken, and they make sure that they finish the drugs. And also they need to know that TB is not an end of life. So they don't need to discriminate those people, other than they just need to take precautions. And also I need to tell the society that stepping over the counter and buying some drugs for any cough above 3 weeks, it raises alarm. Go see a doctor. Yeah.
Thank you very much for being with us for that. Yeah.
Thank you.
So that's all we had for you here in Focus on Health. And remember, the end of the program does not mean that this will be the end of focusing on your health. Remember that you can talk to us on our social media pages at Focus on Health on Facebook, and also you can talk to us on our Twitter pages so that we can also advise you and also just bring in specialists who can at least tell you more about your health. That's all we had for you here. I've been your host, Oumo Nyango. Till next time, have a